Good afternoon. It's 5:30 p.m. here in Seoul. You're watching Arirang News, bringing you live coverage of a briefing from South Korea's health authorities on the latest developments with the novel coronavirus outbreak. The country has so far reported over 3,500 cases of infection. That's as of Sunday morning, after 376 cases were confirmed overnight. The figures are just about to be updated in this briefing coming up as officials fill us in on just what's happening. In a short while, we'll be switching over to the Centers for Disease Control and Prevention headquarters in the city of Cheongju, where the briefing should start very soon. We will be providing English interpretation live as well, so do stay tuned in for that. But first, we're going to fill you in on some news making headlines this hour. First, a total of 79 countries around the world are restricting the entry of travellers coming from South Korea. 36 countries, including Vietnam, Madagascar and Angola, are banning the entry of travellers who've been to South Korea within 14 days. 43 countries, including some African countries like Nigeria and Kenya, have strengthened health checks on such travellers or are isolating them upon arrival. 12 provinces in China are also restricting the entry of those travelling from South Korea. Meanwhile, Seoul is advising its citizens to refrain from visiting the above-mentioned countries. A jump in the number of COVID-19 infections in South Korea is causing large corporations to adopt their own preventive measures and implement changes to the working environment. Our Kim Jae spoke to workers from some large companies in South Korea to find out more.
The fast-spreading novel coronavirus is changing the daily lives of corporate workers in South Korea. Business trips are being postponed and get-togethers are being cancelled.
The workshop that was scheduled for the beginning of the year was cancelled, and most departments are cutting down on socializing together after work. People are refraining from get-togethers as much as possible.
There were official instructions from the company to wear masks even indoors and to frequently wash our hands. Hand sanitizers has been provided everywhere.
Especially with the number of firms reported to be experiencing disruptions due to their employees being infected, companies across the nation are on high alert to minimize any possible fallout from the virus. Many companies in South Korea have installed heat detection cameras at their main entrances to detect high body temperatures. South Korea's SK Group decided to minimize the number of employees at its main office by advising some staff to work from home starting Tuesday. Some SK companies such as SK Innovation and SK Telecom advised staff to come to work by 10 a.m. on Tuesday to minimize contact with other people during rush hour commutes. LG has also taken preventive measures to contain the virus.
LG Electronics is prohibiting all outsiders from entering domestic and overseas business sites as a measure to prevent the spread of the virus. The company is also helping workers who are pregnant and those who need to take care of their children due to school closures by allowing them to work from home for 2 weeks.
LG Electronics also say that it's making employees who commute from Daegu to work from home. With the number of coronavirus infections spiking day by day in the nation, these changes look set to be in place for some time. Kim Jae-hee, Arirang News.
Well, you're tuned into Arirang News, where we're actually now bringing you live coverage of a government briefing on the novel coronavirus outbreak here in the country. The country has so far reported over 3,500 cases of infection. That's as of Sunday morning, after 376 cases were confirmed overnight. The figures are just about to be updated in this briefing as officials fill us in on what's going on. So now we're just going to switch over to the Centers for Disease Control and Prevention headquarters in the city of Cheongju, where the briefing should start very soon. We will be providing English interpretation live as well. So we're going to switch over very soon, and the officials there will be updating us on the latest numbers of the infection cases. And we're now just going to switch over as the briefing is about to start.
So I will be updating on the coronavirus 19. And this is coming from Central Disaster and Safety Countermeasure Headquarters. So under the Prime Minister, we held the meeting on the preventive measures. So we talked about the measures on the COVID-19 and also to prevent regional expansion. And we also talked about the measures for the Shincheonji churches and the demand and supply of the masks. So as of the 1600 hour today, March 1st, the current number of confirmed cases are 3,736, and 30 people have been discharged, and 18 people have died. And this is the result of over 90,000 tests. And we want to ask those who have suffered deaths to rest in peace. So just a week ago, on February 23rd, the government has looked at the status at the time, and we have notified that the most of the concentration started from the Daegu area and the Gyeongbuk area, and it has spread. And if it could not be prevented at the time, then we have explained that we could be facing difficulties. And as such, the danger and the risk factors have been elevated from the reconsideration to a danger stage. And we have taken very thorough preventive measures. And thanks to the strong measures and the cooperation of the Daegu citizens, the speed of the infections coming out of Daegu to other cities is slowing down, and we don't see a quick spread into other regions. And this is thanks to the efforts of the Daegu citizens and all the citizens of Korea. We want to ask you to overcome the discomfort and continue to maintain your mature civic awareness and consciousness. However, it is not at a time for us to feel safe about. Although it is not spreading very quickly to all across Korea, we do see fragmented cases being confirmed additionally. And in Daegu City, concentrating on areas such as the Shincheonji churches, we are actually concentrating our tests there, and we are trying to control additional infections. However, we see that a considerable confirmed cases have been added, so we could see that this region has been infected a lot. And when we look at the frequency of the regular Daegu citizens and those who are the Shincheonji followers, we saw that there was a big gap in the ratios. So we are trying to have prior investigation into the Shincheonji followers. So we have to make sure that we prevent further outbreak. And we have to make sure to pay attention and treat those with high risk. And we have to make sure that the medical team does not get infected as well. And when we consider all that, there is still a possibility that coronavirus could spread across Korea. So the next 1 to 2 weeks will be a very important time point. So COVID-19 has a high infective power and its spread is very quick. So we have to make sure to look into our limit into our measures. So we do see some room for improvements. And we want to thank our citizens. However, we also want to ask you to further overcome the discomfort so that you can be a part of the concerted effort to prevent further outbreak. So there were talks about changing the treatment system in Korea. In Korea, we looked at the current characteristic of the COVID-19 virus, and we also saw that there was a need to change the treatment system. So that decision was made as such. And therefore, the central headquarters has amended its guidelines on the COVID-19, and this will be spread to the municipal governments, and we will make efforts so that this can be carried out. So the need to change the system and for the content, the head of the HQ will be explaining it in detail. So I'll just talk very briefly about the overview. So the COVID-19 treatment system is to have the basic it has the basic principle of hospitalizing all of the patients with confirmed cases. And we have to change the system for 3 reasons in large. First, because of the characteristic of the COVID-19, there are people who are infected. However, there are many who don't really need medical treatments. And when we have these new viruses, we are gaining more knowledge, and as we do so, we have gained this knowledge. It was that over 80% of the patients who are infected have minor illnesses and does not have to be hospitalized. And when we consider that we have limits in the medical environment, we have to make sure to focus on those with severe illnesses, and this will be an important point for us to minimize harm. And for the patients with minor illnesses, if we were to concentrate the medical team there, then that would increase the level of tiredness, and it would increase the need for the medical teams, and it would worsen the situation. And for that following reason, we have decided that we're going to improve the treatment system of COVID-19 to be focusing on those with severe illnesses. And we are going to make sure to support this fully so that we can improve the treatment system in line with what is required. And the core content is as follows. So first, for those who have been confirmed, we are going to have management task forces who will be selecting the level of severity of the illness. So with patients with severe illnesses, we will make sure to hospitalize them as soon as possible so that they can get expert care. And if we have shortages in the hospital beds, for those with severe illnesses, the National Medical Center and the main task force team will make the adjustments so that they can be transferred to the higher level hospitals in other areas. And for the patients with minor illnesses, we will make sure that they are under the livelihood quarantine and they get the support of the medical team in a regular basis. And we will also make use of the public institutions and accommodation centers so that we can make sure to treat them when we need it. The government will make sure to provide quality treatment facility in line with the level of severity, and at the same time, the Central AQ will secure more hospital beds and the medical environment so that we can support those who are infected. And we are going to add more treatment facilities so that we can support the regions who need these. And we are going to transfer the Central Education Center as well. And this will be managed by the Daegu Medical Center. And we are going to use this as one of the test facilities. And we will also make use of other national centers and civilian centers so that we can treat those with minor illnesses. And this includes Seoul University Hospital, Asan Hospital, and Seoul St. Mary's hospitals. So all of these higher level hospitals are cooperating to take care of these, and we're going to also ask other higher level hospitals to participate as well. And we are going to secure more hospital beds. So this includes Daegu Veterans Hospital and the National Mason Hospital and other hospitals already accepting patients. And the military hospital of Daegu is also preparing for it. And in order to treat those with severe illnesses, we're adding more hospital beds, and we're going to secure more hospitals as well. And together with the other higher level hospitals, we are going to cooperate so that we can secure hospital beds for those with severe illnesses as soon as possible. And we hope that the local governments will also form a task force team so that they can select the people by the level of the illnesses. And we hope that they will also add more hospital beds. And if we also get requests from the municipal governments for support, we will support as much as we can. And we also want to ask you to strengthen cooperation among the municipal governments. For instance, if you have to transfer those severe illnesses, and there could be patients from other regions using the hospitals of your region. So in those cases, even if there are requests for transfer, there are some cases where rejection has been made. And in such a case, we hope that the head of the municipal governments and the citizens of the regions will think of it as your own region. So don't think of it as people coming from another region. So government really values the health and safety of our citizens, and it is making full effort to prevent further outbreak of the COVID-19 virus. And we also want to express our gratitude to all of our citizens and those who are supporting us fully. And we also especially want to thank the medical teams who are supporting us, and we will support you as much as we can as well. And for COVID-19, this has the characteristic of a fast spread. So it is difficult for us to resolve this issue only with the effort of the government alone. So we also want to ask our citizens to support us. And most importantly, it is really important that the citizens themselves follow the rules on personal hygiene, such as washing hands and covering your mouth when coughing. And although it may be not comfortable, we want to ask you to refrain from going out of the house or going to crowded places or big congregations. So we want to ask you to pay attention to social distancing. And sometimes risks come from the areas that we have not expected. So, and it spreads to all regions, regardless of any reason. So for us to counter this in an effective manner, we have to make sure to understand that we are a social community and we have to make concerted effort. So when the government, the municipal governments and citizens come together, we will be able to overcome this wisely. Thank you.
Well, that concludes our live coverage of this briefing. That's it from News Centre for now, but we will be back in our 6 p.m. regular newscast. Goodbye.